Good afternoon. Thank you all for joining us for our weekly COVID-19 community update. I'm joined this afternoon by Monroe County Public Health Commissioner, Dr. Michael Mendoza. First, we're going to check in on our numbers. Today, we'll be reporting 213 new COVID cases, which brings our 7-day average of new cases to 193. Last week, we reported 169 new cases with a 7-day average of 142. We've seen a lot of fluctuation in our daily cases over the last week, and Dr. Mendoza will speak momentarily about what he thinks is going on. On the vaccine front, we're continuing to make progress as more than 457,000 Monroe County residents have completed their vaccine series, and over 489,000 have had at least one dose. This means about 4,000 more residents received their first shot over this past week, and we have just over 76% of our eligible residents with a first dose, and just over 71% of our eligible residents have completed their vaccine series. I'm happy to announce our mobile vaccine unit was deployed into the community for the very first time this past week, getting doses out to areas where vaccination numbers are still behind our county's average. We also have a number of vaccine clinics scheduled in our neighborhoods throughout the city of Rochester and across Monroe County in the coming days. All information on dates, locations, times, and appointments can be found by visiting our website at www.monroecounty.gov/health or by calling the COVID hotline at 585-753-5555. As we've said all along, and will continue to say, vaccination remains the best and most effective tool our community has to combat COVID-19. It's free, it's safe, and it works. If you're eligible and haven't been vaccinated yet, today is a great day to do so. Our team is still hard at work scouting locations for mass vaccination sites to offer booster shots, while we're waiting for more information from the FDA regarding who will be eligible and when. But in the meantime, we're still hiring administrative clerks, nurses, and EMTs. All of our positions offer flexible schedules, both in terms of the number of days and number of hours, and offer competitive pay ranging from $17.50 to over $28 per hour, depending on the job. More information and applications for all positions can be found on our website at www.monroecounty.gov. Now, I know there are many questions about the state's vaccine mandate for healthcare workers. The concern is the possible worker shortages stemming from unvaccinated healthcare employees that may not continue their employment once the mandate is in place. Unvaccinated healthcare workers have been the focus of much media attention, but I want to start by flipping the equation. First, I want to say thank you to all of our frontline healthcare workers who've been vaccinated. Thank you to the 91% of those vaccinated at Strong Memorial Hospital and to the 87% vaccinated at RGH. And more are being vaccinated every day. I believe this means that the vital healthcare needs of the community will continue unabated. The state, county, and healthcare system will work together to ensure that the high quality healthcare that we now enjoy continue with as little disruption as possible. There is still, though, much that we don't know. But here's what we do know. We know the state is firm on putting this mandate in place. We know that the recent court ruling did not overturn the mandate, but called for religious exemption. But there is still so much we don't know, and plans are being developed. To that end, the hospitals in the county are still sorting through legal issues and support plans that we will have more information about that next week when we'll be better able to answer particular questions. But right now, there's a couple things I do know. Am I concerned? Of course I am. Right now, we have healthcare workers working throughout the systems that are working 24-hour days. They're working around the clock to make sure that our patients receive all the critical healthcare that they need. Are we making contingency plans for the future? Of course we are. But the one thing I have confidence in is in our two healthcare systems and the men and women who work in them. I am confident that the critical healthcare needs of this community will remain, and I'm confident in the two healthcare systems that we have and their ability to serve our residents regardless of the mandate coming into place in a couple weeks. And we are now also today in a better place than we were a year ago to handle whatever comes our way, because we have one tool at our disposal that's different today than last year. We have a vaccine. As of today, 76% of the county residents have had at least their first dose of the vaccine. 91% of strong healthcare workers have had it. 87% of healthcare workers at RGH. 79% of our staff at Monroe Community Hospital have been vaccinated. And all of us are doing everything possible to get the rest of our citizens and employees vaccinated. We can end this pandemic, but we do it by vaccination. Today, the United Way of Greater Rochester announced that beginning now through September 30th, people who receive their first dose at participating clinics in Rochester are eligible to receive a $100 thank you gift card. Monroe County is pleased to participate in this effort. And thanks to our partners at ESL Federal Credit Union, Wegmans Food Markets, Paychex, Greater Rochester Health Foundation, and the Konar Foundation, who have stepped up to support this initiative. Incentives have played a key role in boosting vaccination rates. This week, all of Rochester's zip codes achieved a 50% vaccination rate, thanks in part to incentive programs and the one-on-one outreach programs that we've been doing for months. Once again, we don't have all the answers today. We're going to continue to monitor all of the legal dealings and mark progress in our healthcare worker vaccination levels, employee recruitment, and whatever help the state is offering. We will have a joint statement on the status of mandates sometime next week. But with that, I'd like to turn this over to Dr. Mendoza, who is going to take some of your questions as well. Dr. Mendoza?
Thank you, County Executive Bello, and thank you as always to our colleagues in the media for helping us to share these important messages with our community. This week, I'd like to focus a little bit around offering some context around these numbers. We have been existing throughout this pandemic, more or less focusing on these case numbers, but I think we're at a turning point in some respects with regard to how we gauge the progress that we are experiencing here in Monroe County and across our region with respect to the COVID pandemic. You heard that our total numbers are increasing, and while this might on some level feel concerning, I do want to offer that the total number of tests that we're doing as a region is also increasing. This is something that we anticipated with the opening of K through 12 schools, as well as the reopening of higher education colleges and universities. So at some level, it really isn't a surprise. In fact, it was to some degree predicted that we would see an increase in the number of total cases. At the same time, we're actually seeing an improvement in the positivity rate, which is a reflection of testing more people who are less likely to be positive and doing more asymptomatic screening, which is what's happening in particular at our higher ed institutions. And so while the total number of cases is increasing somewhat, the positivity rate is also decreasing. So there is some depth to understand when you look at these numbers. But beyond these numbers, I think it's also important to consider the context, particularly with where we are in the school year, having now reopened K through 12 more or less without a glitch. We are seeing still many positive students, largely emanating from travel at the end of summer and many social gatherings existing at the end of summer and now into the school year, particularly with sports teams who are gathering before games and after games and so forth. So I want to encourage everybody to still be very mindful. Thankfully, we are not seeing a huge increase in the number of kids who are falling ill to COVID, but we also know that having COVID of whatever kind can result in quarantining and ultimately disrupting our educational experience for our K through 12 students, something we've been working very hard this past summer to try to protect. To give you some sense of how this problem is growing to some degree, when you look at the total proportion of cases represented among individuals who are between 5 and 18 years of age, that proportion has increased about 6% over the last 2 weeks. So the proportion of positive individuals in that age group of 5 to 18 is increasing with every passing week, which is a reflection of the potential that this might have to disrupt our schools and athletics and all the activities that are associated with being in school. So to that end, I want to offer some recommendations. Number one, although many schools are not requiring the strict symptom screening every day before school, I do want to encourage parents to check in with your children to make sure that they're feeling well. Many times children are coming to school reporting that they have the same allergies that they usually have, and that, you know, in some cases their parents said it was okay for them to go to school. And then we find out later that those individuals are testing positive, which will have an impact, of course, on the rest of that person's classroom or team or what have you. So please pay special attention to your children. You don't have to necessarily check their temperature every day, but do check in with their symptoms and see how they're feeling. Number two, remind your students if they're going to have pre-game or post-game activities following athletics or activities to wear their masks if they're indoors. And again, don't go to these activities if they're not feeling well. And finally, I want to applaud the reality that the vast majority of our children have done very well with masks. We are not seeing very many concerns with regard to mask wearing in our contact tracing. And so I want to emphasize again that that's such an important way that we can mitigate the spread of COVID-19 in our community. The final statistic I want to share with all of you is that the hospitalization number and the ICU admission number is steadily growing. In contrast to our children, this group, this figure represents people in our community who are in fact suffering from COVID. These are individuals that we want to protect, although we have by and large vaccinated the vast majority of people who are quote vulnerable. There are still a large number of people who are vulnerable that are not yet vaccinated. So we all owe it to them to do what we can to keep them healthy and safe. I want to close by reminding everybody that the flu shot is now available. You can get the flu shot on the same day as getting a COVID shot if you haven't gotten your COVID shot yet. But if you've already gotten your COVID shot, it's never too early to get your flu shot. When the boosters come around, it is recommended that you can get your flu shot on the same day as your COVID shot if that's convenient for you. But again, there's really no reason to wait. So feel free to check with your primary care provider or any of the number of local pharmacies that are currently stocking the flu shot. With that, I'm going to hand it back over to County Executive Bello. We'd be happy to take your questions.
All right, first up for questions, we have Raquel with WXXI.
Hi, good afternoon, guys. I mean, you covered mostly, I guess, all our questions. I guess right now would just be, these healthcare workers are, definitely upset and about this mandate. What would you say to these workers where you would think that the community would be priority for them, protecting the community would be priority? How would we get these healthcare workers to meet their deadlines, this mandate deadline?
Well, I'm sorry, Raquel, I think I heard your question. It was a little, but I think the hospital systems are working very hard, as I know Monroe County is with Monroe Community Hospital, to engage with all of our workers, to answer questions that they may have, dispel myths that are out there about the vaccine, and try to encourage all of our employees to become vaccinated. And so there's still a few weeks left before the mandate takes effect. And so what I would really encourage, everyone to do is to take a step back and remember why it is we're talking about vaccination in the first place. The vaccines work. We have gone through a very difficult time period the last year and a half. We've lost so many of our friends and family members to this terrible disease. And our hospital systems and the people who work in them have sacrificed an awful lot. The best way we can get through this to end the pandemic, to get everybody back to work and get back to normal, is to take the vaccine. The vaccination works. It keeps us healthier, it prevents hospitalizations, and it prevents deaths. And we know it works. The science says that it works. And so if you have questions about the vaccine, if there's questions about whether or not it's the right thing for you, the best thing to do is to go talk to a healthcare professional and make that decision for yourself. And I think that you'll find that people will decide to take the vaccine, just like close to 75% of those eligible in our community have made that choice themselves before.
And I'll simply add that, this debate has unfortunately fallen into not why to get the vaccine, but how to make people get vaccines. And I think we need to go back a step and start to answer again why we should get this vaccine. I believe it's our professional responsibility as healthcare providers to keep ourselves safe and to do everything evidence-based within our powers to keep our patients safe. And we now know that the FDA has formally approved the Pfizer vaccine. We've got ample evidence to show that it is working. It's been administered to billions of people. There really is no reason at this point not to get the vaccine. I understand that people have questions. I understand people have reservations about the manner in which we've gotten here. But I do think that if we take a step back and consider this from the standpoint of what do we do to keep our patients healthy and safe, I think the answer, frankly, is very clear.
Okay, Raquel, do you have a follow-up?
Yes, just in regards to the pause on elective surgeries due to meeting this this mandate, and if it's not met, and the shortage of staff causing the pause in elective surgeries, how would you respond? How would you respond to these people that are looking forward to getting their surgeries done, and now they have to wait, possibly not getting it done until months or weeks later?
Well, I'll go back to what I said earlier. Am I concerned? Of course I'm concerned. I'm concerned for those who are going to be, who are seeking healthcare service. I'm concerned a lot for the folks who are working the system. But I'm also confident in our healthcare systems and their ability to provide critical care to our residents here. But what those plans that you're outlining are also just contingency plans. So of course, our healthcare systems are making contingency plans to understand how to address this to make sure those critical functions continue. So there's still 2 weeks left. There's going to be a lot of planning that happen in the next 2 weeks. But while that contingency plan is happening, more people are getting vaccinated. So the condition is going to change constantly. There's a lot more people working in our healthcare systems who are vaccinated today than were vaccinated 2 or 3 weeks ago. And so the condition will continue to change. And so our job is to understand this mandate is taking effect. How do you make contingency plans to address that? Understanding the condition changes every day, but also most critically, as Dr. Mendoza said, is to understand why we're doing this in the first place, because the vaccine works, it keeps us safe, and this is how we end the pandemic.
And the fact of the matter is that our hospitals are not strangers to this. We had to flatten the curve last year. Flattening the curve last year referred to the number of patients that were flooding our hospitals with COVID. And thankfully, we don't have that problem now. We had to flatten the curve last year to help protect our healthcare workers and our capacity to make sure that we were able to take care of the critically ill. Right now, we will be able to take care of the critically ill, but unfortunately, if we don't have the staffing, it may come at the expense of elective, so-called elective cases. So what are these cases? Well, these are cases that aren't urgent, but they aren't optional. Okay, these aren't cases that people wouldn't otherwise do if they had, the option. These are important medical procedures that need to be done. And the challenge with an elective case today, if it goes on undone, is that it may become urgent down the road. And so these elective cases are not trivial. They are not incidental to people's healthcare. They're important cases. And unlike last year, we actually have the power to turn this around. Last year, we didn't have a vaccine to prevent COVID. And right now, the largest travesty of this entire situation is that we actually have the ability to turn this entire situation around if we had more people getting vaccinated.
Okay, next up we have Jennifer Lukey with Channel 10.
Good afternoon. I have one question for each of you, if that's okay. We'll start with Dr. Mendoza. When it comes to taking the kids out of this, we see from a statewide level and in other counties, they break down the numbers based on who's been vaccinated and who hasn't. We don't provide breakthrough cases in our data. Is there a reason for that? And what are we seeing? And then to go along with the school thing, with all these additional children testing positive, they have access to that testing in school now as a requirement. But what about the general population? Is there any look at expanding rapid testing for everyone? I know the county does it a couple of days a week at the Fleet Center, but are you looking at expanding that at all?
Great. So to your first question about trying to divide out the vaccinated versus the unvaccinated, we can do that from the standpoint of cases. And it does take a fair bit of work. And we had talked very actively in the department about whether we wanted to go that route. But my impression is that it doesn't necessarily change very much because we're getting a lot of asymptomatic positives among people who are already vaccinated. So it doesn't actually help us to understand who's getting sick or not among the people who are not hospitalized. So our focus really is around those who are sick enough to be hospitalized or in the ICU. And in trying to figure out who's vaccinated and not, the challenge then came up when we got the hospital numbers, is that mixed into all of that is the individual who is hospitalized for, say, an elective procedure who happens to test positive. So they may have COVID, but not be sick from COVID. And so that really muddied the waters with respect to trying to develop what I had hoped to do, which was to develop a relative risk of being hospitalized, comparing unvaccinated to vaccinated individuals. So, we did this analysis for about a week and the number swayed, more than I would like. But in general, the relative risk of being hospitalized, not in the ICU, when you compare unvaccinated to vaccinated people, is somewhere between 4 and 6 times more likely. But that's a large sway, one I'm not generally comfortable with seeing from day to day. And so my impression before I can put something out there is I want to make sure it's correct before we go public with it, so to speak. But there's no question that people who are unvaccinated have at least a 3 or 4 times more likely chance of being hospitalized if they're unvaccinated as opposed to vaccinated. Now, with regard to your question on testing, there's no question that we want to have more capacity for testing. Right now, the priority is around schools, given the mandate to offer testing to all unvaccinated students, which is going to end up being an offer to all students, vaccinated and not, in our school settings. And so right now, we don't have the capacity to handle all of the public. So for that reason, we're prioritizing the K through 12 schools primarily. But my hope in the coming months, particularly as cold and flu season come upon us and colder months are drawing near, that we're going to have expanded testing, and we're going to want to have that in our community settings in the future.
Thank you. And I'm County Executive Bello. Earlier this week, the Pagulas and the Erie County executive handed down some mandates about vaccines for folks who are going to Bill's Stadium. We know the Pagulas are tied to some sports here in Monroe County. Have you been in conversations with them about whether there will be any sort of vaccine mandates for Amherst games, for Blue Cross Arena? Where do you stand on that?
Yes, we have had conversations with them. In fact, we just met this morning, most recently, and we're working through what we think the best protocols will be, and we'll have a decision on that to announce in the next couple of days.
All right, next up we have Natalie Tutchko with 13 Lamb.
Hi, everybody. I have a question regarding the healthcare worker shortage. Today, we spoke with an adult care nurse who is taking on more hours, accruing overtime for not only the widespread shortage, but an increased shortage due to folks who are choosing not to get vaccinated. They're quitting as well. So what might the response be from your perspectives for folks like that who are adding on more work, more hours, and whose company may not be allowing for this extra coverage, for this extra work?
I'm not sure I fully understood the question. Let me address it by saying this. Again, this goes back to the greater overall concern, right, of where we are. There are healthcare workers right now who are working an incredible number of hours, just like they did back earlier this year, and frankly, have been doing for years. We've had a shortage in the healthcare system of staff that goes back years. And so what you have to have in place right now, in the conversations that are taking place, is you look at short-term, midterm, and long-term planning, right? Short-term planning is what contingencies do you put in place to make sure that critical care continues to be received by residents in our community with less staff. And so those plans are taking place right now. Then you have your more midterm and long-term plans related to how do you attract more people into the healthcare system and in the healthcare world. This was a big part of the conversation, particularly around nursing homes, long-term care facilities that have been understaffed for generations here. And how are we attracting more people into the system? So you have to be able to do both. You have to think about what comes next week, 2 weeks, and a month from now. But you also have to think about year 2, 3, and 4 down the road. And you have to do it while also understanding that you're part of one large ecosystem. They don't operate in silos, right? So as nursing homes and staffing in nursing homes begins to contract, they're able to offer less beds. When you have less beds, it becomes difficult for hospitals to discharge patients that need to be discharged into a nursing home. And so then they start taking on additional bed space with individuals who don't really need to be in a hospital, but should be more in a nursing home. They just don't have a place to discharge them with. So you can't do any one of these functions in a bubble. You have to understand how they're all related to each other. And so that's why the short-term planning is a lot bigger than just saying how many beds will you shut down. That's not the question. The long-term question is how do you attract more people into the healthcare system? So you have to be able to do both plannings at once. But I'll go back to what I said earlier too. Is part of response is we have to thank our healthcare workers. We don't want that be dismissive of the work that they've gone through. These are the heroes in our community who stepped up and have been at the front lines of this fight over the last year and a half of this virus, and have been, putting everything in their lives on hold to protect us and keep us safe. And so I think we have an obligation, the rest of us as a community, to do what we can to get them back to normal and give them the resources they need to do their jobs. And the only way to do that is to vaccinate.
All right, Natalie, if you're all set, next up we have Brian Sharp at the DNC.
Thank you. I was wondering if either of you could speak to, we talk about the vaccination rate for healthcare workers or hospitals. Do you have any sense, obviously within that is a number of different job titles, where the real concern point is? I mean, I think we often think of just nurses, but there's, or maybe if you know specifically from Monroe Community Hospital, of how that breaks down and where we're seeing the biggest gaps.
Well, I'll start. I mean, I would direct you to the hospital systems, Brian, on what they're seeing within each one. In Monroe Community Hospital, though, we are seeing that amongst a lot of different job titles across the board. You know, I have a concern for our employees who are there and the burden and the load that they're taking on as it increases on the medical care side. As we lose folks who are directly related to medical care, but we are also losing a lot of support staff positions when you're looking at food service workers and things like that. So it really is across the board.
And I'll simply add that, you know, at any role in a healthcare setting where you have individuals who are not doing the right thing, let's just call it that, they're not doing the right thing by themselves and by their patients, it's going to have a ripple effect. The rate of vaccination among physicians is very, very high, in the high 90s, but it's not 100%. And to the extent that physicians can be leaders in their healthcare settings, frankly, I'd love to see the physician number be as close to 100% as possible. When you look at other roles, the vaccine rates may be lower, but there may be substitutes in certain roles. And in other roles, there may be no substitute. You may find, for example, in a hospital, if there is a shortage of individuals in sterile processing, you might say, well, you know, what difference does that make? Well, it turns out that makes a huge difference. If you don't have people in sterile processing who are there to do the job, the operating rooms grind to a halt, even if the surgeons and nurses and scrub techs and everybody else are there to do their work. So in a delicate balance, particularly like we're one right now during a pandemic, every role in the hospital matters. And we don't want to pass up on any opportunity to work together to help our community.
Thank you. And Dr. Mendoza, I was wondering if you could go back a little bit. You were talking about the testing in schools. And I know, just speaking personally, we got a notice from my son's preschool today that we'll be beginning random testing of 15% of staff and students later this month based on your department's recommendation. What are you seeing as far as participation? And I guess can you talk a little bit more about just how this will be rolled out?
So we're still in the early phases of this. Right now, we are in the process of distributing the test kits to all of the schools in the county so that they're prepared for when this goes live later this month. For their part, the schools are doing their work to try to determine how many individuals are going to consent to testing, particularly among the students. For instructors, for educators who are not vaccinated, they all must test every week. But it turns out that a number of educators who are vaccinated are also hoping to get tested as well. So we're trying right now to figure out how many people will need to get tested every week, and we're trying to do some modeling at the district level to figure out what their plan might be. So when I talk to the school superintendents and school leadership, the testing protocol really depends on a number of factors. Number one is, what is the prevalence of disease in the community? What is the cases per 100,000 over the last 7 days that we report on our dashboard? The second is, what's the vaccination rate in that district? In fact, we have vaccination rates by district for school-age children. We share that with the schools, and we also have the overall zip code rate. So we factor all of those in to sort of determine what's the pre-test probability of having an individual who might test positive and who's asymptomatic. The third is, you know, what are the results of contact tracing? And so that's perhaps the most important. You know, so some schools are saying, well, we're going to do more testing among athletes who are under the age of 11, for example. So we've allowed the schools to develop their own testing protocols based on their local needs. And, I offer guidance wherever I can, but ultimately this falls to the school districts to develop and implement a plan that makes sense for their school community and their parents.
And if I could just clarify, you're recommending that for other childcare settings too? Daycares, preschools?
I haven't met with the daycare programs individually. I've met with the schools, and many of them have a pre-K or a preschool component. So for those schools, I've met directly with them, but I haven't met directly with the daycare settings. But I do know that there are daycare settings who do want to do testing, and I think that's fully within their purview if they want to go that route.
All right, thank you, Brian. Next up, we have Christian Garzone from Channel 8.
Well, so I'll take your second question first, which is a question you all ask me every year, which is that what is the flu season going to look like? And the answer is every flu season is different. So last year we were, to our surprise, to our delight, we didn't really have a flu season because it turns out that when you're wearing your mask and social distancing, it's actually quite hard to contract influenza. This year, I think jury's still out. We don't know what it will look like. We obviously have a very high COVID vaccination rate, but will that mean, as you suggested, that people might be tired of getting their vaccines and will elect to not get the flu vaccine? And I hope that's not the case. I'd like to think that the community can handle taking 2 shots and that won't contribute measurably to their fatigue. But there's no question that people are tired of this pandemic, and I can understand why people are frustrated. But my hope is that people will step up and get the flu shot as they normally do. Our vaccine rates for the flu are typically in the 50% range, so a little over half. But this year, hopefully, people will pay more attention to it. And I think we have to revisit the reality, which is that as a country, prior to the 2020's flu season, we were accustomed to seeing 50,000 people die because of the flu. And last year, that number was very, very small, which leads me to conclude that these deaths from flu are preventable. I'd like to think that we can all step up and do what we can to protect our loved ones from dying from the flu. And if there's anything good that we learned from last year, it's that we can actually work together to prevent 50,000 deaths from the flu. So let's all do our part. The best way to do that is get the flu vaccine. Well, the numbers have inched upward this past week. I think it's because of testing in the schools and so forth. So I think it's too early to say that it's plateaued. It may be increasing slightly, but my hope is that we're still in a plateau situation.
All right, thanks, Christian.